The next item on our agenda is we really wanted to take some time to unpack our short-term strategy that we've been advocating for several months now. A lot of this is born out of an ongoing community conversation as we think about Springfield and as we've seen just the need around homelessness in our community. Um, we want to share very clearly about what the continuum of care, the Heartland Continuum of Care, is advocating for. And some of that that I hope to do in the next few minutes too is to clear up some misconceptions about what the continuum of care even is and what it can accomplish and can do in our community. When we hear conversations at city council or in other public forums, a lot of times there's some great components there, but sometimes too the impression is that the continuum of care is something a little bit different than what it actually is. And so the first thing that I'd love to just talk about is we, as we gather on this call, are all part of the general membership. And so you are a part of the continuum of care, and you're a part of this work that we're doing to end homelessness in our community. And so as we engage in this work, part of our mandate comes from housing and urban development. And really our goal as a group, as a body, is to take our collective impact, to take our expertise, and to strategize and plan a coordinated and comprehensive approach to providing housing and services for people in danger of becoming homeless or experiencing homelessness in our community. And we do that work by promoting an integrated community-wide strategy and then planning to prevent and end homelessness. And then we provide coordination among the numerous local organizations and initiatives that serve the homeless population. So we're a community that you'll hear it said sometimes that we're resource rich. We have a lot of fantastic partners who are engaged in that work. And so helping us all to communicate together and be on the same page is part of what the continuum of care is and does. The continuum of care, however, does not control organizations. When you hear some of the comments made, you might get the impression that we as the continuum of care have the ability to tell organizations, independent organizations, what they should do and when they should do it. And that is not the case. In terms of funding, sometimes you might get the impression that the continuum of care is sitting on a large pile of money that we are not getting in the hands of our agencies, and that also is not the case. The federal government, HUD, has a continuum of care program. The competition for that will be beginning here in the next couple months, but our community gets about $400,000 roughly through that program. A lot of that is used for permanent supportive housing and other programs as part of that. And a lot of that is wrapped up in renewals. We have organizations that are doing great work around that. And so that funding goes towards that. Part of our community improving and getting better at what we're doing and how we're coordinating services and strategy is that we want to do increasingly better through that competition and bring more funding to meet the needs in our community. But the other source of funding that commonly comes through the continuum of care and that we talk about in this body is the Emergency Solutions Grant. And so that funding is around $130,000 on an annual basis, and can be used for things like rapid rehousing, emergency shelter, street outreach. And so those are the two pieces of funding that the continuum of care works with. And the continuum of care is not a 501c3, so we're not a pass-through. We don't hold that money. So really, our role is to plan, to organize, to coordinate, but it's not to control our agencies. We really, our imperative is to work together to end homelessness and to try to pull together all the community partners we can in that work. So represented on the call today, we have partners from the medical community. We have partners from local philanthropy, from organizations who are doing great work. And so that's the work that we're doing and the work that we'll continue to do. And one of the key ways that we organize that work is the crisis response system. So as we adopted this model back in 2018, it's a best practice that communities across the country are using to be effective at actually addressing homelessness in a holistic way and ending homelessness in communities. And there are 5 key components of the crisis response system that we've adopted as a community. The first one is outreach. A lot of our organizations have outreach initiatives, right? So for example, connecting with people who are unsheltered and helping them to become aware of the services that are available to them. That's an important part of the crisis response system. Another key component is coordinated entry. HUD mandates that our community have a way to prioritize and assess people who are experiencing homelessness and to connect them with the appropriate services. And so coordinated entry is the way that we do that. Prevention and diversion, to the degree that we can help a person to avoid homelessness to begin with, that's something we want to take very seriously, and that's a key component of the crisis response system. Emergency shelters, when people become homeless, we want a place for them to experience the stability of a bed and care and case management around that, so that they can work and access different resources available to them to end their homelessness. And then permanent housing, right? The crisis response system, if we're really going to do this work of ending homelessness, we need housing outputs. We need the ability to take a person who is experiencing homelessness and help them through the coordinated entry process connect with an appropriate housing intervention, whether it's rapid rehousing or permanent supportive housing. And so this is the system that we use. This is the way that we organize our work, and it's in line with what communities across the country are doing as they're really addressing homelessness in a holistic way. But as a local community, as we look at the system and as we look at where we are, we constantly want to improve, and we want to get better at this, right? And the way that we do that as a community is really expanding the resources that are available. With the current pool of resources that are available in our community, we are like communities all across the country who have an inadequate amount of resources to address a complex social need. And so there's a lot of unfortunate things that flow from that. One key piece of that is that it leads us to a system to address homelessness that is effectively stuck. This slide is from the National Alliance to End Homelessness, and I think it captures pretty well where we are as a community. We have a number of people who are unsheltered. We have a number of people who are sheltered. And we have a number of people who are supporting and housing, but we can only do that to the degree that we have appropriate housing supports, which means, a place for people to go, a rental subsidy to pay for that, but also supportive services. The work that the continuum of care does to help a person in stable housing is not housing only, it's housing plus care, right? Case management and other supports that help a person stabilize in a meaningful way in housing. And as a community, we have an inadequate supply of permanent supportive housing and rapid rehousing to meet the level of need we have for people who are sheltered in emergency shelter or who are unsheltered. And so one of the key ways that this has manifested itself in our community over the last several years is that we create seasonal overflow shelter. And I think it's important to sort of see this, right? So when we do that, and I guess to go back, in this scenario, we have 49 people who are unsheltered, 30 people who are sheltered. This is purely for example. These are not our local numbers. So what we do around November of each year is that we create this overflow shelter. And so we go to a lesser number of people who are unsheltered, an increased number of people who are sheltered, but it's the same number of people who are experiencing homelessness in our community, right? When we create more emergency shelter or we create more overflow shelter, it's an important intervention, but it doesn't end homelessness. And it's important for us to keep that on our minds as we advocate for a way forward. But there are ways to move forward also that actually end homelessness. In this scenario, we have 34 people who are unsheltered. We have 30 people who are sheltered. But then we've moved 15 people into rapid rehousing. And so we've helped them into stable housing. And so again, in order to end homelessness, housing is key. And as a community, we will not end homelessness unless we invest in housing, unless we help our agencies increase their capacity to hire case managers to create those supportive services, and also come alongside that with the rental support that's needed. That's the key to moving forward. So one of the things that you hear often in conversations in the public is that, well, as a community, we don't have a plan. And when you hear that, what I want you to know is that we do have a plan. And any entity that says we as a community don't have a plan, what that means is that entity themselves doesn't have a plan. And we would encourage them to get more deeply connected with the continuum and support the plan that we're advocating for to end homelessness. As a continuum of care, we put together a strategy work group last year, looking in the midst of a pandemic, looking towards the ongoing pandemic and the needs that would exist. and we worked together to put together a short-term strategy. And the short-term strategy is how we believe we can move forward right now in an effective way to actually address homelessness and work towards ending homelessness, functionally ending homelessness in our community. And some of the key components of the plan that we're advocating for and have been working to execute are rapid rehousing and permanent supportive housing. As funds do become available to us, we are prioritizing some of these interventions with those funds. And so when $600,000 became roughly a little bit more than that through the CARES Act for the Emergency Solutions Grant, we were able to allocate over $150,000 to expand rapid rehousing initiatives. And that was through two organizations, Helping Hands. I'm sorry, another person's entering the call here. Helping Hands has had a rapid rehousing program and has had a great deal of success with that, even throughout the pandemic, and continues to build on that work. And Mercy Communities is in the process of creating a rapid rehousing effort, and we're really excited about that. Alongside that, through the American Rescue Plan, a brand new program was created to foster a partnership between public housing authorities and continuums of care. And our community was allocated 35 emergency housing vouchers. And so these vouchers, it's been a wonderful opportunity for us to partner with the Springfield Housing Authority. These vouchers don't work off the same waiting list that the Springfield Housing Authority has. It works through our coordinated entry process, which is again, it's a new program. We're still in the midst of developing exactly how that's going to roll out. And then these vouchers also come with some administrative support dollars. And so as a community, we've been thinking about how to best use those. And one of the key things that we're working to create through that is a housing navigator position. This is a position that's never existed in our community, to my knowledge. And Helping Hands is actually going to be the entity that's going to hire that person, and that person will serve the continuum of care for these emergency housing vouchers. And in the general membership email, you received a link to that job description. So I encourage you to check that out and look at that. Actually, responses are due tomorrow, and we'll talk about that a little bit. It's another agenda item here in a moment. So, but that's a key development. As we think about how do we look at moving forward, often people ask us, well, what are we talking about here? What kind of money would make a really tangible difference for people who are experiencing homelessness in our community? And as we've looked at those numbers, as we've looked at what it would take to increase case management capacity, supportive service capacity, but also to create rental support. We've developed basically a rough number that's $750,000, an investment in the community to create a flexible pool of $750,000 that could be used for case management and rental support. It could help over 100 people in our community. Now, when we say that, it would take some time to hire people and to ramp those programs up. But if that level of money was made available to the continuum of care to spend on rapid rehousing and permanent supportive housing, we could help build that capacity among our agencies to serve over 100 people. Our current coordinated entry list has over 100 people on it right now who are waiting for rapid rehousing and permanent supportive housing expansion. And so it's not a mystery what we need as a community. It's really clear what we need. We need more support to expand permanent housing. And that's got to be a key point of strategy for any funding that becomes available in our community, because that's what ends homelessness, right? Along with that, homelessness prevention is key, right? To the degree that we can help people from experiencing the trauma of homelessness, we want to do that. And Fifth Street Renaissance has been a fantastic partner in our community in that work. And recently, the Illinois Department of Human Services has created and expanded an emergency rental assistance program. Fifth Street was among 7 homelessness prevention providers in the state that applied for those funds and received those. And they'll be receiving over $500,000 for this emergency rental assistance program for this fiscal year. More information will be coming out about that. But also during the second round of Emergency Solutions Grant CARES Act funds, we as a continuum invested $150,000 in homelessness prevention to really hopefully help avoid the fallout of the eviction moratorium. And so that's a key point of intervention as well. Emergency shelter. This is another, and probably this is the point that at this point in time is getting more conversation in the community. And as we look at emergency shelter in our community, we really want to look at the data, right? How many beds are available? For our existing emergency shelter providers, right? So Helping Hands, Contact Ministries, Youth Service Bureau, Sojourn Shelter. These are organizations that are fully staffed. These are organizations that have expertise in providing this shelter. They have case management, they have services, partnerships with medical community, all built into the work that they do. And as a community, it benefits us to help people access the services that these shelters provide. For the last 2 winters, we've created a winter emergency shelter that did not work through an overflow model. And so in a sense, that shelter competed with the other shelters in our community. And the result of that really is not an efficient use of funds for our community. And so we began advocating last year that when the winter emergency shelter closed, we really wanted to see an overflow shelter take its place. Now, the reason we advocate for overflow shelters is exactly what I said. We want to connect people with the shelter beds that are already available in our community, paid for through various entities, and deeply connected to those supportive services. We know that there are gaps in our system, right? We do not have enough emergency shelter capacity for the number of people who are unsheltered and experiencing homelessness. So there is space that we need overflow for those who don't fit within our existing capacity. There are also people who, for various reasons, may not be eligible for shelter beds in our community. And so the overflow shelter will help to address some of that need as well. And then a key part of the overflow shelter is that it's designed to be a low cost intervention, right? So we want this to help meet this need, but to do it in an economically efficient way so that we can continue to invest in rapid rehousing and permanent supportive housing. So as funds become available, our priority one is supportive housing, ending homelessness. But while we do that, we still need this Band-Aid type of effort is sort of how it's referred to really help make sure we have a safe place for people to get off the streets and to begin to stabilize and connect with those case management services. So we continue to advocate for that. We would like to see that as a year-round effort. And as we look at the numbers, we anticipate that an overflow shelter would likely serve probably in the winter up to 30 people. And so it doesn't need to be a massive effort. It really needs to be the right size in order to use funds wisely and make funds available for those housing interventions. And so we'll continue to advocate for that. We know that the city and Salvation Army are in conversations about that. 2 weeks ago at the city council meeting, Mayor Langfelder talked about the development of non-congregate emergency shelter. At this point, we don't really have a clear idea of what that means as it comes from that direction, or what exactly is being worked towards there. And we continue to seek conversation there to learn more. But we really hope that the city and any other funding entities would join us in this effort and in the strategy that we've developed here. Another key piece, another thing that has been said at City Council is that agencies aren't doing enough as it pertains to outreach. We have a number of different outreach efforts in our community. Some of them are volunteer run. Some of them are from supportive services for veteran families. Some of them are through local agencies who have employees who are working in a number of different directions, but also go out and do outreach. And then we also have Chris Jones, our homeless outreach team lead. And then we have organizations like Helping the Homeless in Springfield. So there's a variety of outreach work going on. And we've been pulling that team together to really focus on how to do that outreach in a way that really connects people with services and works with them in the direction of housing. And so as we do that, we're excited that Memorial Behavioral Health and the city of Springfield have partnered using some of the city's CDBG CV funds to create a position at Memorial Behavioral Health for that outreach work. It's great for us as a community to have more people who are devoted to fully devoted to that outreach effort. And so for that to continue to grow is a great effort to connect people with these services and with these agencies that exist. Another thing that we're working on is the development of an app that would help our case managers, help those doing that outreach work to collaborate in a pretty seamless way as we work with people, particularly who are unsheltered. And then another thing is we put this strategy together, just recognizing coming out of the pandemic, the need for day services. And Washington Street Mission at the beginning of May began a phased reopening and has continued to expand their services as they're able to. And as a community, we want to encourage that expansion and help to support them as they continue to serve people in a variety of ways. So there's a lot there. And I know you may have questions. If you have questions, what I would say for the sake of time is that I would love to connect with you one-on-one. And so please feel free to reach out to me through email. You got the general membership email. You could simply respond to that and say, hey, Josh, I'd like to talk about some element of the short-term strategy. I'd be happy to do that. But we have a plan. We have a plan that frankly, if our crisis response system is adequately funded in the way that it needs to be, our community can make significant strides to reach functional zero to end homelessness. We have fantastic agency partners in place. We have fantastic partnerships with the medical community. All of these can be built on with more resources invested strategically and smartly. And as a continuum, we have to continue making that known and continue pushing in that direction. A couple of key things that I'd also like to mention is that we have an unprecedented opportunity here. And again, it's absolutely imperative that we use these resources that are in our community and coming in our community in a strategic and smart way, that we make decisions that are driven by our local data and really, again, place that focus on ending homelessness through these supportive housing interventions. The city of Springfield this year will receive over 2.3 million, almost $2.4 million through an entirely new program. So the city of Springfield each year gets homes or gets funds as part of what's called the Home program. And through the American Rescue Plan, HUD has created this new program called Home ARP, so Home American Rescue Plan. And what it does is it takes a traditional home program. It really, and the goal as it's stated on HUD's website, is to assist individuals or households who are homeless, at risk of homelessness, and other vulnerable populations by providing housing, rental assistance, supportive services, and non-congregate shelter to reduce homelessness and increase housing stability across the country. And it can be used for these 4 eligible activities: production or preservation of affordable housing, tenant-based rental assistance, supportive services, homeless prevention services, and housing counseling, and then the purchase and development of non-congregate shelter. So at this point, this is basically what we have around what this program will consist of. HUD has not released guidance about how exactly these funds can be used. I'm really hopeful that maybe they take a similar approach as they did with the emergency housing vouchers, where in order to get those funds and use those funds, the continuum of care had to enter into an MOU with the Springfield Housing Authority. I would love if HUD would do something similar with this. In order for our city to use these funds, if the city and continuum of care had to enter into an MOU together, I think that would be a really effective thing. But part of that is these are funds that will come to our community that the continuum of care, as it appears, has no control over. We will be bringing a recommendation to this body, and we'll be making a recommendation to the city about how we think these funds can be best invested, looking at local data and looking at that goal of actually ending homelessness. And we look forward to the partnership that can flow from that. But we want you to be aware of this because, again, this is an unprecedented amount of money coming to our community to address homelessness. And for us to use these funds in a smart and strategic way could really be transformative for our community. Another key thing about these funds is they can be used through 2030, right? So when they come in, we don't need to spend them in 3 months on one project, but we can really look at our long-term needs and make a plan for using these funding that can create some sustainability, around addressing the need in our community. And I'm wrapping up here, I promise, for those of you that are sleeping. While we work on all of this, at the same time, we are in the process of developing a long overdue community-wide strategic plan to address homelessness. And we're doing that with the support of the City of Springfield, the Community Foundation for the Land of Lincoln, Memorial Medical Center, Sangamon County,
You said his name is
SIU, Springfield
Thomas,
Housing Authority, St. John's Hospital, and the United Way of Central
and you
Illinois.
did it
So
today.
while we work on these short-term initiatives, we also will be putting over the course of the next 6 months, and you certainly will be a part of that process, we'll be putting together this long-term strategic plan to really give our community a clear clear action
Okay.
steps for moving forward.
Yes, we
So
can look at
we as a
the
community, we have a plan, right? What we would really love for you to do is to join us in advocating for this plan. And then the other key part, frankly, I'm frustrated with the fact that our agencies who are under resourced continue to be dragged in public
all
forums.
right, just let me know.
I thought Erica
And
Smith, everybody, if you could check to make sure you're
I'll step
on
up.
mute, that would
Well, I
be
know
that
I
would be
can't do it
fantastic.
tonight
Thank
because we
you.
have someone that's having surgery.
Sounds
So
like she might be on the phone and don't realize it.
Right. I can't get
yeah.
to I lost my, all right, we'll let it roll. Um, as a community, Erica Smith did an interview with Sam Madonia last week that I thought was really fantastic. It's worth a listen. You should go to, it's posted out there on WMAY's website. There's a link on the Continuum's Facebook page. And I thought one of the powerful things that she said was just around our need for our community to unify. We need to hold our community leaders to a standard of helping us to unify, not continuing to to take shots at agencies. Let's build together towards this future that is very realistic of functionally solving homelessness in our community, and let's stop the rhetoric and the political games. We have a plan. Support this plan, and let's move forward together. And if we don't, we continue to create a community where people suffer and are unsheltered needlessly. So please join us in advocating for the agencies you work with, the agencies you support. Tell the stories of the great work you're doing, but also hold our community leaders to a standard of working with us and working in a unified way to truly end homelessness.